Assalamu alaikum. In this video, we will discuss patient safety during management of cardiomyopathy in pregnant patient. Patient safety means making sure that patients really get good care that helps them to feel better without any extra risk or problem. This needs teamwork from all the healthcare providers in the hospital as well as the patients and their families. Everyone works together to make sure patients are safe and well taken care of. It's important that careful consideration of both the mother's health and the well-being of the developing fetus are kept in mind. Pregnancy can put an additional strain on the cardiovascular system due to increased blood volume and hormonal changes. We will discuss two types of scenarios. Firstly, a non-pregnant patient presents with a history of cardiomyopathy in the past pregnancy and she wants counseling before she becomes pregnant. The next scenario would be a pregnant patient who either presents in the antenatal clinic with a past history of cardiomyopathy in her past pregnancy, or a pregnant patient presents as an emergency. In the situation where the patient has presented for preconception counseling, we need to understand the potential risk of the condition for pregnancy. It's important to assess the severity of the cardiomyopathy and the residual changes, her functional status, and her overall health to determine if pregnancy is advisable. The counseling has to lead to an appointment with a cardiologist who will evaluate the patient for determining risk for future pregnancy. For preconceptual counseling, we need to have some understanding of what residual changes can occur after a patient has gone through this cardiomyopathy episode. Because this is associated with the weakening of the heart muscle and impaired pumping function, it can lead to heart failure. While many women with cardiomyopathy can recover with appropriate treatment, there can be residual pathological changes in the heart. And these changes include a dilated cardiomyopathy, scarring and fibrosis, decreased ejection fraction, and remodeling of heart tissue. So, it is important to note that many women will achieve significant recovery with proper medical management. And this will include medications, lifestyle changes, and in some cases, medical devices like an implantable cardioverter-defibrillator or cardiac resynchronization therapy. Each case is unique and the extent of residual changes can vary widely. Close collaboration with healthcare providers and ongoing cardiac monitoring are essential for managing the condition and its potential long-term effects. In the other scenario, we see that the patient attends the antenatal clinic during pregnancy with a history of cardiomyopathy in the past. One of the most important factors or considerations to ensure safety of the patient is to have a multidisciplinary team approach. The cardiologist will determine current and future risk. And this team-based approach ensures that all aspects of the patient's health are considered. The risk assessment of the patient's cardiomyopathy is essential. This includes evaluating the type and severity of cardiomyopathy, left ventricular function, and any associated complications. Some medications used to manage cardiomyopathy may not be safe during pregnancy. The patient's medication should be carefully reviewed and adjusted as needed. Some medications may need to be discontinued or replaced with alternatives that are safer for the developing fetus. Another step that will keep the patient safe is to ensure that regular monitoring of the patient's cardiac status is maintained. This can help identify any deterioration in heart function very early on. Encourage the patient to do home monitoring and to report to emergency if there is any irregularity in the monitoring status. Along with the maternal health monitoring, we also need to do fetal monitoring, and this is done through regular ultrasound examinations to assess fetal growth, development, and placental function. Planning the delivery is a crucial step in ensuring the patient does not spiral into an emergency situation. And the mode of delivery and the timing of delivery will depend upon the patient's cardiac status, gestational age, and the overall condition of the mother and the baby. Vaginal delivery may be possible in some cases, but a cesarean section may be recommended if there are concerns about the mother's cardiac function. Anesthesia and pain management is an important consideration during labor and delivery, as pain can exacerbate an already serious underlying condition. After the patient has delivered, the postpartum period is a critical time for monitoring, as cardiovascular changes will continue after delivery. Close follow-up is essential during this time period to manage any potential complications. Breastfeeding consideration has an effect on maternal as well as fetal safety, and this may be influenced by a number of factors. Medications used to manage cardiomyopathy may impact breastfeeding. The patient's condition after delivery may also influence her breastfeeding. The patient should discuss the benefits and risks of breastfeeding with her healthcare team. It is crucial that patients are advised for contraceptive use after they have delivered. Sterilization is the best option when future pregnancies are severely contraindicated. In other cases, the patient can be encouraged to use a non-hormonal or a low-dose hormonal options, and the options will include barrier method, intrauterine device, progestin-only methods, or natural family planning methods. When dealing with heart problems in pregnant women, doctors need to create a plan based on the woman's health, status as well as the possible dangers to her and the baby as a result of the pregnancy. So in conclusion, it is important for the medical team and the patient to talk and work together closely to keep the patient safe during and after pregnancy. With this, we come to the end of the video. If you like the video, please press the like button, share the video with friends and colleagues, write comments about other topics on which you would like to receive the video, subscribe and press the bell icon so that you can be notified of future videos. Thank you and goodbye.